Hey, I'm Joe Connolly of WCBS News Radio 880 with another stop on the WCBS Small Business Comeback Tour brought to you by PSE&G, helping small businesses throughout New Jersey to save money and energy. Erwin Strohmeyer is the founder of SterileSpace.com. What a timely title for a new business line that he found that is. Erwin had a background in the medical industry. We'll find out about that. But like many business owners, he found a whole new business line during the pandemic. Tell us what that is and was, Erwin.
Well, first, Joe, thank you for having me on. It's a pleasure to be on your show. Um, the way sterile space infection defense came about was back in 2013 when I had gone out on my own. And unfortunately, at the same time, my father was on the exit ramp of life. With numerous infections. So that became near and dear to me, not to mention the fact that he had been a doctor his whole career. And being the son of a physician, you're kind of drawn into it a little. Back in 2013, I started Sterile Space Infection Defense and spent a lot of time trying to build it. And of course, unfortunately, when somebody said the word pandemic in March of 2020, that really catapulted the business. But we were in business long before the pandemic. And what we do is we go around and provide infection prevention, control, and eradication services, not to be confused with a cleaning service. They don't do what we do, and we don't do what they do. We are the next bigger and more important step after cleaning is done to help prevent the spread of infection.
Now, I've read on your website that you spray. It's amazing to see you come in and do all this spraying that you do and cleaning. Do you spray with antimicrobial substances in layman's terms, Erwin? Is that right?
Yes, yes. What we do is we come in, we do a full decontamination of the facility, a full terminal disinfection of the facility, and then, kind of like McDonald's and Burger King with the secret sauce, we apply an EPA registered long-term antimicrobial coating onto all the surfaces. And that material bonds to those virgin clean surfaces, and we warranty the efficacy of our entire project for 12 months from the date of application. And what that coating does is, as microbes or cells come down on the coating, if you could see the coating on a microscopic level, would look like zillions of little swords sticking up. And as that cell comes down, it gets impaled on the coating, and the coating has an opposing electrical charge, which in essence electrocutes those cells, so they are in essence rendered neutralized. And when you neutralize a cell, there's not much more it can do to anything or anyone.
What a great explanation of high science. What were you doing in the medical industry before this new line took off?
I had started a medical equipment and instrument company, oh God, back in, I think it was 1998, if I remember correctly. And we would source and supply surgical instrumentation to surgeons and medical equipment to their hospitals or their clinics or their doctors' offices. We also became rather well known in veterinary medicine for creating a lot of instruments that doctors didn't have before. So we would go around and equip these medical facilities with, whether it was surgery lathes or scalpels or scissors or patient monitors or what have you. And I did that for about 20 some odd years.
Will this sanitizing line continue, do you think, well after the pandemic?
I hope so. I really hope that, and it's sad to say, but I really hope with the loss of over 900,000 people in this country alone, that maybe people were paying attention and realized that, yes, germs can actually be deadly. And the thing is, prior to the pandemic, I would go and meet with a lot of different places. We do mostly childcare centers, but we've also done some restaurants, some doctor's offices, a hotel or two, private homes. We can also do vehicles. But the thing is that, you know, for forever, we have felt that if it looks clean and smells clean, it's got to be clean and safe, which is so far from the truth, it's not funny. Because most of the time, over 80% of the time, according to a lot of the stuff you can read from CDC, NIH, WHO, and other things like WebMD on the web, people get sick most often by touching a contaminated surface and then touching their eyes, nose, or mouth.
Yeah.
These are the three primary entry points for infection into the human body, because you have 1, 2, 3 mucous membranes. And once microbes get onto a mucous membrane, they have everything they need to survive, thrive, and most unfortunately, colonize that surface, which
Wow.
means you touch a dirty doorknob or a dirty countertop or anything, you know, a railing or a door handle walking into a restaurant, and then you touch your face. If those are infectious microbes on your fingers now, they're going to colonize the inner lining of your eye area or your nasal cavity or your mouth, and then spread throughout your body and get you sick. So
How do you find clients, Irwin?
well, prior to the pandemic, I would walk into a lot of places, hand them my card, tell them that we do public infection prevention or public health safety. All right. And oftentimes we would be asked to explain that, and that would lead to a proposal and then to a job to do. And a lot of our clients find it to be very beneficial. They've seen, especially the childcare centers, have seen what they claim to be a 50 to 70% reduction in infection issues in their schools between students and staff.
And do you advertise, or is it word of mouth?
It's been mostly word of mouth. We've tried a variety of different types of advertising. We've tried direct mail, which helps a little bit. We do a lot of email blasts, which seems to help a little bit. We tried billboard advertising, digital billboard advertising, which was the best $730 I ever spent in 1 month to find out I shouldn't have spent any more than that. It didn't work.
Well, thank you. You know, you're the type of business owner we love to talk to, because your knowledge and your belief in your product and your way of explaining it all are really very good. And I can see why you've been successful in your different businesses for a long time. Good to know you. Thank you, Irwin.
Thank you, Joe. A pleasure speaking with you today.